Your time. It can be a scary road to recovery for some coronavirus patients, especially for those who have to be put on a ventilator. Denver 7's Micah Smith joins us live this morning. And Micah, a local doctor that you spoke to, walked you through the sometimes very long recovery process.
Brian, and the key word there is long, and it only takes 48 hours on a ventilator for you to start feeling long-term impacts of being on that ventilator and the long-term impacts of COVID-19. I talked to Denver Health speech pathologist, Dr. Thomas MINIAC, and I asked him how he can tell if it's going to be a long road to recovery. He says if you come off of that ventilator and you have trouble eating or speaking, he can tell it's going to be a tough road ahead. And that's the case for about 70% of his patients. He says it takes a lot of work and practice to get to that point where you can swallow and eat again, starting with trying to swallow a teaspoon of water or a tiny bit of applesauce. He says many patients who haven't used their vocal cords for weeks due to the ventilator also need to learn to talk again. Learning to do this can be tough in the COVID section of the hospital due to all of the machinery in the room, so it's very hard to hear doctors, and vice versa, hard for doctors to hear you. So MINIAC and other pathologists are using special masks so that they can hear patients and so that patients can hear them loud and clear, and so that they can also read each other's lips.
So we've been able to use these masks, which are CDC approved, and we can get into a room with visual cues being able to be seen by the patient.
MINIAC says he just wants everyone to know the impact of COVID-19 doesn't end when you leave the hospital or test negative. He says for many, the road to rehabilitation is long and it lasts well after a hospital stay. Reporting live, Micah Smith, Denver 7.